Hello everyone, I am Dr. Pallavi R. Gangatkar. I have just finished my institutional fellowship in reproductive medicine from Garbhagudi Institute of Reproductive Health and Research. So when I first decided to do fellowship in reproductive medicine, I was confused to where to join, how the cases would I get enough hands-on and things like that. So I started visiting places to know more about the fellowship courses there, and finally decided to join Garbhagudi Institute of Reproductive Health. So when I came here, I came to know the whole course is very well structured over the duration of 1 year. So when I joined, we first initially had 11 days of comprehensive transvaginal ultrasound course or training by Dr. Supriya ma'am. So in that training, the training basically was divided into modules which covered from basic to advanced transvaginal scans, which included both gynec and obstetrics. And end of that course, we had an exam as well to know how much was the learning. So that was very helpful clinically when we went to the clinics. So after the training, we had an andrology course for a short duration of 5 to 7 days, where we were exposed to basic semen analysis, the computer-assisted semen analysis, and also the semen preparation techniques. Then we also got introduced to the embryology lab in the basic visit. Then after that, we were posted into clinics. When we were posted into clinics, we were trained under Dr. Raja Murali ma'am and Dr. Asha ma'am. So in the clinics were basically divided into the operation theatre, clinics from the operation theatres, and also in the outpatient department. So when it came to outpatient department, we had scans for follicular monitoring, we had procedures like intrauterine insemination, and we were also exposed to andrology part of it from the lab, say semen analysis. We also saw few semen preparation techniques, and also we could interpret all the semen parameters that was done. And we also, under assistance of Dr. Rajamam, we also have performed many intrauterine inseminations in OPDs as well. So apart from that, we had also had minor procedures like intrauterine installation of GCSF or endometrial scratching, mock ETs, and things like that we've learned in the clinics when it came to minor procedures. And we have seen a large number of cases. There are large number of cases from basic infertility to advanced infertility, those who require laparoscopy and everything. So in between all of this, we also had got assigned few hours for initial oocyte pickup under simulators. We had a simulator before entering the clinics for OPU per se. We had simulators on which we had to complete 25 cases of oocyte pickup. And then after we had completed a 25 cases of oocyte pickup, we started doing oocyte pickup under guidance of our consultant. So in the OT, we were exposed to oocyte pickup, the fresh transfers, the frozen embryo transfers, and procedures like cyst aspiration, laparoscopic procedures, advanced laparoscopic surgeries, maybe myomectomy, endometrial cyst excision, and even adhesiolysis and things like that, and hysteroscopy. We got a lot of hands-on on hysteroscopy as well under the guidance of our consultant. We will also have a dissertation presentation in our course of this duration of 1 year, where we'll be assigned one topic and we'll have to do a data collection, and this will be helpful for our further publication, as we know how important the publication also is in our career. So basically, this was a very well structured course. With this, not only once we enter clinics, it's not only the clinics. Every week we used to have dedicated time for academics as well. In academics, we had our case presentations, we had our journal clubs, and we also had the journal topics that was covered by consultant. And out of this academics, we had assessment exams. We had assessment once in every 3 months. So the whole course, we had 3 assessments and then one mock exam, which included the whole of the syllabus, followed by an exit exam, which included both theory and practical exam. So I am very grateful that I have joined this center for my fellowship in reproductive health medicine, and I'm greatly thankful for Dr. Asha ma'am for giving me an opportunity to do my fellowship here, and I thank my consultant Dr. Raja ma'am, and I highly recommend any aspiring reproductive medicine doctors who would want to join this course would be very, very helpful for our clinical practice. Thank you.